You're going too fast. Slow it down.
Speed freaks me out as a doctor. Because as a regular person, I've went in an F-16, and that one went really fast. I also pulled 9.3 Gs. Oh. You know, that fall wasn't terrible. There wasn't an abrupt stop. There was a lot of rolling involved. Oh, see? What is he chasing him for? The guy's going like 40 miles an hour. You're not running that fast. All right, first of all, there's no way he got there that fast.
I don't think you have any idea how fast I really am. What do you got?
16-year-old status post ATV crash, 40% of burns on his body.
Okay, so the way they estimate those burns is based on the rule of nines. Here's an image that we use to estimate the amount of body that's burned. Important to know that adults are different than young babies. Babies have bigger heads in relative proportion to their limbs and rest of their body, so interesting.
Nasotracheal intubation. Start a bag of lactated ringers wide open.
Yeah, fluids are one of the most important things that we give in the midst of a burn. Not only do you dehydrate quickly, but you also need very careful management of your electrolytes. That's why one of the first things you get is an IV inserted to pull some blood and see what the person's electrolyte status is through what's known as either a BMP, a basic metabolic paddle, or a CMP, which is a complete metabolic paddle.
Potassium's low, which can also be explained by the burn.
Which is what we were talking about earlier when we said that electrolyte disturbances are common. One of those electrolytes is potassium, but also sodium.
Except I'm sure the burn unit's pumping him with fluids, which means his potassium should be going up, not down. Could be amphetamines. Or bacteria lunching on his heart. Or cardiomyopathy, or some other very bad thing.
I mean, those are all possibilities, but naming things that are just totally random probably doesn't help in this situation.
You. Okay. No skin, no EKG. We need help from a Belgian doc named Eindhoven.
I mean, that's so typical from House. Not let's wait for his body to stabilize and see what happens, which is what happens in every other hospital. He calls a Belgian doc for his help.
While he was alive, he invented a little ditty called the galvanometer.
Where do we get one?
Go to any electronics store that's been open since before 1905. There's a good chance they got one in the corner in the basement.
Because of the burn, we can't perform any of our normal tests to see what's wrong. So we're going to try a galvanometer.
That's a good question. How do you do an EKG on a person with significant burns? We have modified the ECG electrode by welding the ECG button to a crocodile clip. So you just have a little clip instead of a pad. But in House MD, instead of following what is this? The European Journal of Anesthesiology, why can't I speak today? It tells you just use a modified ECG electrode. He's like, get a galvanometer.
He's got all these burns, and now there's something wrong with his heart?
We're trying to figure out if the two are somehow connected.
Yeah, that happens very commonly. Arrhythmias are not rare in those who've had significant burns.
If he was experimenting with amphetamines or cocaine.
No.
I mean, how do they get there? Because his heart rate's elevated? He's in the midst of a terrible accident.
We gave him some pot about a year ago to try.
It was just once. We thought if we took the mystery out of drugs and alcohol, the less he'd experiment.
We'll know more after the tests.
Looks like they're gonna electrocute him. Prominent U waves.
No, inverted T wave. No ischemia. Q wave normal.
That's not a normal rhythm. I don't know what it's drawing because I don't know this device. That does not look normal. Seizure activity?
Chase, turn it off. Turn it off.
I don't think that's because of the device. I think he's just having a seizure, no?
Who electrocuted my patient?
What?
He had a seizure.
He wasn't electrocuted.
What does the seizure tell us?
Okay, thank you. At least House has my back. I mean, low potassium levels can precipitate a seizure.
Differential diagnosis, go.
Could be epilepsy or seizure disorder.
He just named 2 seizure disorders.
Could be MS. Seizures could be caused by plaques and lesions on the brain.
They're basically acting as WebMD. Did one of the symptoms match the disease? Yes. Say it.
No nuclear imaging. He wouldn't survive the move to radiology. MRI and CT scan are both out.
Why wouldn't he survive the move? I guess infection?
Lumbar puncture will tell us if his proteins are elevated. At least we can exclude MS.
Can't do a lumbar puncture either. We'd be inserting a needle into an area that's teeming with bacteria. If he doesn't have a brain infection already, we'd give him one for sure.
Why don't they just clean the area? I'm so confused.
There's no other way to look at a brain.
Transcranial Doppler sonography.
What? He's gonna get an ultrasound of his brain for what?
You're not gonna get a diagnosis of MS from a sonogram?
Not definitively, but patients with MS have more reactive neurons in their occipital cortex.
Oh my God. So ridiculous. The idea that this is MS is so wild without having any symptom knowledge of the patient is just beyond me.
Are they trying to wake him up? They can't do that, right? He'll be in too much pain.
Don't worry, he's still under. But the brain never completely sleeps, it's always working. The eyes respond to visual stimuli. Blood flow increases in certain areas of the brain, and we can track that with the sonogram.
Functional MRIs maybe, but on a patient that is under anesthesia, I mean, I can't imagine the imagination of the person who created this.
With MS, blood vessels are more reactive, so flows faster.
No one would make a diagnosis of MS using this technique.
Chase, near the subarachnoid space.
Aneurysm, what are they seeing?
We found a subarachnoid bleed. Bleed in the head isn't causing seizures.
I mean, it totally can. I don't know why he said it doesn't.
It could be. 10% with damage to the cerebral cortex have seizure.
Thank you. Can someone else defend me?
Or bacterial meningitis.
Viral encephalitis?
How are they getting here? He doesn't have a fever. He doesn't have a white count that we know of. He has two issues at most. One is he has a fast heart rate, and two, that he has a disrupted electrolyte imbalance, which all can be blamed on a myriad of reasons that are more likely than MS or bacterial meningitis. He just had literally a trauma and he's bleeding in the brain, and they're thinking about blaming it on a bacteria as opposed to the trauma that he just had.
Fix the bleed or he dies. I'll talk to you in a couple of hours.
I'm in the subarachnoid space.
Can you get it?
I think so. Put the probe back where it was so I can see the wire.
We're looking for the bleeding up.
Look when I get there. I'm flying blind without a contrast CT here.
He's going blind with an ultrasound. This is so unethical and illegal. This literally would never happen. Never.
It's something that disrupts brain function. The plaques are perfect. Interrupt neuronal communication.
MS?
No. MS is complicated. I think this is more basic.
Hyperbaric chambers are used for those who have really bad wounds. I love that he has no problem going to a hyperbaric chamber, but going to get a CT scan will be way too big of a problem.
Let's go. House wants to... Adam's waking up.
Get the anesthesiologist in here now.
What do you mean? You were just sticking a wire in his brain. You can't do some sedating meds?
That's not pain. Need some help in here.
Adam had an orgasm.
Oh, House MD. Yep.
Maybe pain caused the orgasm. You get a tattoo, the brain releases endorphins, which create pleasure.
Most people don't orgasm from a needle prick.
If sensory information got misinterpreted by the medial forebrain bundle, it's possible for bad to feel good and good to feel bad.
So what attacks the medial forebrain bundle?
Infective neuropathies, vasculitic neuropathies.
Krabs disease, metachromatic leukodystrophy.
Let's name every disease that impacts the brain and hope we find one. Because he had one seizure after a trauma and because he has low potassium. Do you know how many patients of mine have had low potassium in the hospital? If I did this to all of them, Jesus.
What if it's just a regular old infection festering in the burned skin?
Pus on his arm isn't causing problems in the forebrain.
He's on 20 different medications to manage his pain in his heart.
He's also probably on like quad antibiotic therapy in the hospital. Maybe not quad, but he's definitely on big guns. They're not allowing him to lay there unantibioticed.
The brain is stressed. An infection elsewhere could put it over the edge.
So we just wait for his burns to heal to see if you're right? If you're wrong, he doesn't have that kind of time.
What makes you think he doesn't have that kind of time? Like, your assumption is wild.
Dominic Larry.
He another dead doctor?
He's Napoleon's surgeon-in-chief.
Ooh, that's
Cleaned
important.
a lot of battle wounds.
By amputating legs.
And with bugs.
Maggots are implanted directly into Adam's burns.
Yeah, that's not unusual. We do that therapy sometimes to consume the necrotic tissue because they only feed on the necrotic tissue, not the live.
Maggots, they eat dead people.
Maggots eat dead flesh.
Thank you.
Only dead flesh. So they're perfectly suited to clean wounds. They also kill the bacteria that thrive in injured tissues. Maggots did great for the burn. But the brainwaves are still all over the map.
Who's checking a patient's brainwave? This has never happened in the history of hospitals.
Something's interrupting his neurons chit-chat like lesions.
We can't scan for them. The only test we can do, we just did, and it was negative.
I'm pretty sure you can scan him. Cover him up, send him to get a CAT scan.
He has no tingling, no numbness. And you read his history.
How do you know he has no tingling numbness? You can't ask him.
Parents didn't say anything about Adam. We can't look into his brain, but you want us to read his mind.
Good point. I need to talk to him.
House, you can't wake up a burn victim to play 20 questions. It's torture.
He won't remember.
He's going to be an extraordinary...
God, you're good. You're putting me to sleep. I know he's going to be in pain. I know you disapprove. I'm his attending. Wake him up.
Are you his attending? Like, I don't even know what role he plays in this hospital.
Oh my God.
I'm Dr. House.
And he's gonna thrash, he's gonna pull out his wires, and then congratulations, House.
It hurts.
It's gonna get a lot worse, so answer fast. Before the accident, did you experience any numbness or tingling in your finger?
Oh, he's gonna remember that in this moment.
Any tingling in your arms or legs?
Do something, I can't.
Adam, you gotta listen to me.
You gotta listen to me, champ.
Let me tell you something.
I pissed my pants and then I don't remember.
God, that was a huge load, whatever he injected him with. That was a lot. Urinating oneself, losing control of one's bladder could be a sign of MS. Not saying that House is right still. It could also be a seizure.
I know what's wrong with our patient. He's depressed.
He told you that when you woke him up?
Told me he pissed his pants and blacked out.
It's not diagnostic of depression. Lack of appetite, isolating yourself.
Uncontrolled.
Thank God Foreman came in with the symptoms of depression.
Urination and blacking out are good predictors of what?
Seizure.
Which means the seizure he had when you tested his heart was at least his second seizure.
Depression and seizures aren't correlated.
No. Do you know what is?
Self-medication? Drug use?
Antidepressants have been known to cause seizures in kids, but not orgasms. This is a brain in trouble.
This is a brain with too much serotonin.
Are they saying he has serotonin syndrome? He'd be so hot right now.
If Adam has serotonin storm, it's deadly.
But treatable. Cyproheptadine.
These are not the symptoms of serotonin syndrome. But usually it's like multiple medications given at the same time.
Where are you going? I'm gonna talk to the kid again. Seems nice.
You can't.
Why? Did he say he doesn't like me?
Anesthesiologist told the parents what you did.
Everyone's a tattletale.
I mean, how does he keep his job after that? I guess he's gonna save the kid's life.
I think he's gonna wake him up again.
I know he is. House, you can't do this.
Relax. They're gonna sue us? If I'm right, I save his life. If I'm wrong, he's dead no matter what I do.
Why is no one else in the hospital worried about this child except House? Like, if there was a serious threat to his life, the entire department would be trying to figure this out.
You gotta stop this.
You're right. He's not depressed.
Oh, you're right. I was about to murder the child.
I'm not letting you go till you give me that syringe.
What's that on his wrist?
A burn.
Cigarette burn?
It's a perfect circle.
So a drop of burning gasoline fell on his wrist, a screw from the ATV.
Yellow? Cigarette?
He has a cigarette burn on his wrist. Fading nicotine stain between two fingers. Bad news, your son has a filthy, unhealthy habit. Good news, he's trying to quit. Bad news, the quitting's killing him.
He took too much nicotine?
No smoke meds or antidepressants. Crappy ones you get over the internet. Loaded with whatever antidepressants they can get cheap. And since mommy and daddy obviously didn't take him to a pediatrician, sorry, I was wrong about him being depressed.
So he was taking an illegally bought antidepressant and an illegally purchased smoking cessation product, which likely meant he was taking an SSRI, and then he purchased like Wellbutrin to help him stop smoking, also known as bupropion, which is also an antidepressant, which can lead to serotonin syndrome. Wow. What I don't understand is he was stable. His blood pressure was fine. His pulse was fine. Replete his potassium. He would have healed up. He wouldn't have been taking those meds because he's fine. He would have just recovered. House, y'all need to chill. On The Good Doctor, they had a giant tumor on an episode. Click here, check that out. Let me fact check it. As always, stay happy and healthy.